Knock knock.
Yes, come in.
Hi, my name is Amy. I'm going to be your nurse for today. Your doctor has ordered a head to toe assessment. Is that okay?
Yes.
I'm going to perform some hand hygiene and provide us with some privacy. Can you verify your name and date of birth for me, please?
Michelle Bishop, 9588.
All right. And do you know where you are?
Yes.
Where are you?
I'm in Bon Air.
Do you know why you're here?
I'm helping make a video.
All right. And do you know what
Last
year it
one.
is? What?
2021.
All right. So that means that that completes your neurological assessment. You are, you know your time, place, situation, and your name. So you're oriented times 4. Okay. So I'm going to start from the head, work my way down. Okay. So I'm going to examine your hair and your scalp. I'm going to notice that you do have 2 different colors. So you dye your hair.
Yes.
Okay. And you have no lesions in your scalp. All right. Move. Okay. All right. So the next, I'm going to examine your head and face. I'm going to make sure that everything is symmetrical, which is normocephalic. I'm going to move down to your ears, which I noticed that they are of normal size, symmetrical for your head shape. They are not too large, not too small, and the pinna lines up with the lateral canthus of your eye. Are you having any headaches?
No.
Any dizziness?
No.
Are you having any hearing trouble?
No.
No? Okay. We're going to do a whisper test. So if you could just cover one ear for me. I'm going to whisper something in this ear, and then I want you to repeat it back to me.
1, 2, 3.
Okay. You cover the other ear.
ABC. ABC.
All right. Perfect. So now we're going to move down to your eyes. What we test for is our acronym PERLA, that your pupils are equal, round, and reactive to light and accommodation. Okay. So I noticed that your pupils are round. You are alert every time I move. You're looking at me. Okay. So we're going to measure first your pupils, and they are a 4. So from 2 to 4 is the expected range before light is shown into them. So what we're going to do, I'm going to shine the light in one eye and make sure that the light reacts along with your other one. Okay?
Okay.
Perfect. All right. They did react to light. So what I want you to do is stare here. I'm going to bring the pin in. I just want you to keep your eyes focused on the pin. And I want to make sure that your pupils accommodate, which they do. Okay? Any blurred vision?
No.
Do you wear any contacts, glasses?
Yes.
Both. Okay. Do you wear them frequently?
All the time.
All the time. So you have contacts in right now?
Yes.
Okay. Next, we're going to move to your nose. Notice that your nose is symmetrical. Next thing we're going to do is nostril patency. If you would just cover one side for me, breathe in and breathe out. Any troubles?
No.
Cover the other side, breathe in and out. Any troubles?
No.
Any runny nose?
No.
All right, so we're gonna move to your mouth. Okay. Any problems with dry mouth?
No.
Any sore throat?
No.
All right. So if you would go ahead and open up, we're gonna take a little look. All right. So everything is pink and moist, which is expected. Don't notice any teeth missing, any abscesses or anything like that. We're gonna move down to your neck. I'm gonna make sure that if you would like swallow, and I'm gonna make sure that your trachea stays midline. Okay.
Okay.
Go ahead. Perfect. All right. We're gonna move down to make sure that you're dehydrated, which we're gonna test for a skin charter. So we're gonna check the elasticity of your skin. Okay. So I'm just going to lightly pinch here on your clavicle, and it does bounce back. All right. So I'm going to note that I don't see any physical deformities. You are dressed accordingly, groomed accordingly. Your skin is of, is even throughout. It is typical for your ethnicity. Okay. I do note some freckles on your arms and a few on your legs. So we're going to move down to your cardiac assessment, okay?
Okay.
So I'm going to listen to your heart valves. We're going to go on the right side here, the second intercostal space. We're going to listen to the aortic valve. Straight over to the pulmonic valve. We're going to move down to Erb's point. Tricuspid valve. And the mitral valve. Are you nervous? Because it's beating quite fast. Okay. Any chest pain?
No.
Difficulty breathing?
No.
Okay. All right. So we're going to I heard no adventitious sounds with your heart. The normal lub dub S1, S2. So we're going to move to the lungs. Okay. If you would, we're in the right upper lobe. I'm sorry. Go ahead and take a deep breath in and out. Deep breath in and out. We're going to go down to the left lower lobe, in and out. The right middle lobe, in and out. The right lower lobe, in and out. And we're going to listen to the left lower lung over here, in and out. Go ahead and lean forward for me. We're going to listen to the back. The right upper lung, in and out. Left upper lung, in and out. Left lower lung, in and out. And right lower lung, in and out. Perfect. All right, so no wheezing or crackles heard. No adventitious sounds. We're going to move to, I'm going to check your fingers, okay? I'm going to note that your nails are, there's no clubbing. They are of expected color. Your nails are trimmed and groomed properly, okay? You don't have any cracks in your nails or anything like that. I'm going to test for capillary refill. They refill within 2 seconds. Now I'm going to assess for any edema, which is swelling. No swelling. All right, we're going to move over here. Do the same. Perfect. Edema. All right, so while we're up here, we're going to do range of motion and a little strength exercise, just a little resistance, okay? We're going to do your elbow and your wrist. If you would go ahead and flex your arms to bring it back and then extend it out. Do it one more time. Any problems? All right, no crepitus noted there. Go ahead and push against my hand and push against my hand. Perfect. We're going to move down to your wrist. So what I want you to do is bring your fingers up, which is hyperextend, extend, and then flex. Do it one more time. Any pain? All right. Go ahead and press against my hand and press against my hand. Perfect. All right. So we're going to do the same thing over here. Go ahead and bring your elbow in and out, in and out. Any problems? All right. Go ahead and press against my hand and press against my hand. Perfect. Down to the wrist. So we're going to bring your fingers up. Yeah. Perfect. Any problems there? Okay. Press against my hand and press against my hand. Perfect. Do you exercise on a daily basis?
Yes.
Okay. All right. That's great. Good job. So now we're going to assess for your pulses. Okay. So I'm going to just kind of put my fingers here. Which is a 2+, which is easy to palpate, an expected finding. Same over here. Now, if they were uneven, I would listen for your pulse at the apex, okay? You also have your brachial pulses on each side, your axillary pulses, your carotid here in your neck. You have femoral. Behind your knee is your popliteal, and your dorsalis pedis is on top, and then your posterior tibial is behind your ankle bone, which we'll assess those in a minute. Okay. I'm gonna do my first check. Okay, so we would just, I'm gonna hold you here for just a second. All right, so your respiratory rate is noted at 20 beats per minute, 20 breaths per minute, I'm sorry, which is within the expected range. I note that you're not having difficulty breathing, so what we would note is it is even unlabored, and a word we use for that is eupnea. Okay, so we're going to move down to your pulses on your feet. We're going to find our dorsalis pedis here. We got a 2 plus and a 2 plus. Again, easy to palpate and an expected finding. So we're going to go back here to your dorsalis pedis. All right, 2 plus. And 2 plus, perfect. All right, while we're down here, we're gonna go ahead and do range of motion and strength on your knees and ankles, okay?
Okay.
So what I want you to do is kind of scoot forward off the chair for a little bit. I want you to bring your knee back, or your foot back, I'm sorry, and then extend it out. So I'm gonna keep my hand here and do that one more time. All right, I felt some popping here in the right knee. Is that normal?
Yes, I've had surgery.
You've had surgery, okay? Go ahead and press against my hand and press it. Perfect. So we're going to move down to your ankle. So what I want you to do is, there you go, and point your feet down. Go ahead one more time. All right. Any pain? All right. Go ahead and press against and press against. It's all right. Go ahead and kick your knee back or your foot back and extend it out and kick it back and extend it out. All right, I noticed some popping there. Is
That's
that normal? Okay. Surgery on this knee too?
No.
Okay. All right. Go ahead and go ahead and pick your feet up. There you go. And down and up and down. Perfect. All right. Push against my hand and push against my hand. Go ahead and we're going to come back to the knee here. Go ahead and kick your, there you go. And press against. Perfect. All right. Any issues there? Okay. Now we're going to assess your abdomen, okay? Okay. Go ahead and lay down for me. All right, so I'm going to note that the abdomen is flat. The skin color is even throughout. She does have a few freckles. She does have 2 scars, one in her right lower quadrant and right upper quadrant. And what was the surgery called again that you had?
An adrenalectomy.
Adrenalectomy. Okay, so we're going to note that. Now we're going to listen to the abdomen. We're going to start in the right lower quadrant where bowel sounds are activated. And we're going to be sure that our stethoscope is touching skin. Right lower quadrant, we're going to move up to the right upper quadrant. Move over. Left upper quadrant and left lower quadrant. All right, so we're going to flip over and listen with our bell for any bruit sounds, any vascular sounds, which we hope we do not. Right upper quadrant, left upper quadrant, and left lower quadrant. And we're going to listen up here. So Okay, I do not hear anything. That's awesome. All right, so now we're going to palpate. Okay, I'm going to lightly press here in the right lower quadrant, noting any nodules or any pain from the patient. Anything? No. Okay. Right upper quadrant. Any nodules? Nothing. No pain. Anything here? Nothing noted there. Anything there? Okay. So now we're just going to go a little harder. Okay, a little deeper. Anything there? Okay. Anything here? Anything in the left upper? Left lower? Good. All right. Go ahead and sit up for me. Think about where I was at. All right. And have you been having, when was your last bowel movement?
I think it was yesterday.
Yesterday, of normal consistency, no diarrhea or anything like that? Okay. Are you passing gas normally?
Yes.
Okay. No issues there? All right. And when you urinate, are you having any urgency in not being able to go? Is there any color or odor when you urinate? Okay, so no pain.
No pain.
Okay, good. All right. We use the Braden scale to base you on where you're at for skin breakdown. 3 of the risk factors are mobility, friction and shear, and nutrition. So we would, based on how much intake or if you're able to get up and things that fall into the certain scale, we would grade you on that, okay? Also, if you were unconscious or just recently had like a brain injury or something like that, we would assess your level of consciousness with the Glasgow Coma Scale. It assesses for your verbal response, your motor response, and your eye response. One more check. What time am I at? 17. All right, one last thing. I'm gonna lay you back at a 45-degree angle, and we're going to assess your jugular vein distension, and there's none noted there. If you would turn that way, none noted there. All right, and our last thing we're gonna do is we're gonna check for balance. If you would go ahead and stand up for me, go ahead and just put your feet together and your arms by your side. Go ahead and close your eyes. So what I'm gonna do is put my arms out here about 2 inches, and make sure there is no abnormal swaying, which you do not. Okay, go ahead and open your eyes. If you would walk towards the camera and then turn around and walk back to the chair. You can do it again. Yeah. All right, so I noticed that you have a steady walk, which is good. You can go ahead and have a seat. You have any questions for me?
No.
Okay, the doctor will be in just a minute. I'm going to perform some hand hygiene, and I'll be over here documenting, okay?
Okay.